What's going on, everyone? Happy Friday to everyone. Hopefully everyone is doing well, staying safe, healthy. If you had to take a COVID test, hopefully you have tested negative. If you did test positive, I hope you have a full and speedy recovery with no long COVID issues. It is time now for the Friday edition of the Pandemic Update for Friday, August 2nd, 2024. If you're new to my channel, this is where I do the daily pandemic update on all things COVID and any other virus that could be a health threat to you. Let's face it, there are a lot of different viruses out there, and each of them carry various different risks. Today we're going to talk about a few of them, starting off with measles, and then of course the ongoing COVID pandemic. We're in the summer surge edition of the pandemic, which means levels, they're elevated right now. Levels are a lot higher than they were back in the spring. You may have heard about a surge back last winter. Then you probably heard about COVID levels being low in the spring. What you're not hearing much about on the news is coverage of the current surge. Right now, surge, it's rather large. There's a lot of people sick right now. Is it the biggest surge of the pandemic? No, it's not, but it's one where you need to be protected and be in the know of what's going on. You need to continue to mask. You also need to continue to test. Testing is very important when it comes to COVID. You need to know what you have, whether you have COVID, something else, because guess what? If you don't test and say you're sick and you go out, well, potentially you could have COVID and you could give it to someone who is high risk or someone else. You don't even need to be high risk to get a moderate to severe case of COVID. It oftentimes happens at random, and in many cases, mild cases or less severe cases are the ones that go on to develop long COVID. So you really need to be informed with what's going on, and that's what we do here each and every day. No matter what, I try and get something to you every day. All right, if you want to subscribe to the channel, hit that subscribe button down below. Give this a thumbs up. Share this with anyone you know to help get the word out that, hey, someone's keeping an eye on what's going on. Someone has our back. Someone's watching what's going on to keep us informed. And that's me. Anywho, hit the notification bell and leave your comments down below. All right, going to do kind of a shortened update today. It's been an absolutely horrible day for asthma, so we'll see. So far, knock on wood. Let's see if we can get through this today. All right, measles cases confirmed in Wayne County, Michigan, making this is Michigan's 7th case this year. Yeah, that's not a good thing. So, yet again, another measles case in Michigan. Ohio, well, we can kind of partly see Ohio. There's a paywall on this article today, but we can at least see the cases, and it does look like the cases had a significant increase in Ohio. Cleveland, Ohio, for the 9th consecutive week, number of new COVID-19 cases in Ohio worsened, rising from 4,575 last week to 5,962 this week, the state reported on Thursday. All right, moving on to the update from Jay Weiland. His estimated daily infections for COVID in the United States has gone up even higher to 900,000. Think about that. 900,000 infections a day right now. Yes, that's not so low levels anymore. You think that would warrant more attention on the news? Some local outlets are carrying it, but you hardly hear much about it at all on the national news, partly because it is an election year, but, I mean, this deserves more attention. 900,000 people a day, that means, yeah, a certain percentage of that will go on to develop long COVID, and we do know there is becoming labor shortages in the workforce. I mean, there's becoming a lot of problems that are starting to happen. Hey, I just saw today that unemployment claims, they're starting to go up. Now, that could be for various different reasons, but you have to wonder. I mean, it's hard to get disability here in America in some cases. You have to wonder, some people are now unemployment. You just don't know. You know, there's various different reasons people get laid off. Maybe they're having trouble with focusing during work. I have heard of a few cases of that recently where someone got let go because they're just having too many health problems. They're saying, you know what, we can't commit to you with all these doctors wanting to keep going. Sorry, we're going to have to go a different route. It's happening. I'm telling you, this stuff is happening. All right, moving on now. Taking a look at this, he did say as hotspots like Florida, California, and Texas peak and start their decline, many states that were low to moderate are increasing, like Colorado and Illinois. KP.3.1.1 will continue to push numbers up for the coming weeks. So it's going to be kind of a tossing around. Some places will be peaking, other places will be rising. So the national level, it may not go straight upward, but it's not going to be dropping fairly soon because you do have other places that are just now starting to go up. However, we are losing some of the bigger states. Florida, California, and Texas, those are some of our worst states right now. Having them drop is key. And why, probably, I think, the national level probably won't go up much higher because Illinois, Colorado, they're somewhat of smaller states right now. New York State also does look like it's peaking, in my opinion, but we'll have to wait and see. Could KP.3.1.1 cause it to start going back up again? They just had a LB.1 wave in New York City, New York State area. I'll show you that in just a little bit. Taking a look now at the website, there's something big here I want to show you. Something I think is needed because I've been getting a lot of questions. Do you have a link to such and such data source? Do you have a link to the news story? Well, guess what? Each and every day when I do my update, as today we only did just a couple news stories, I'm going to make a thread in this brand new section, which is called Pandemic Update, News Stories and Data Sources. Eventually I will add my data sources. Maybe I'll get to it this evening. Maybe I won't. The ads. We're going to be doing some work on fixing these pop-up ads on the website. I do not like that whatsoever. But right here, it's on the homepage. Pandemic Update, News Stories, and Data Sources. And you can see right here. Here it is. So you can click on yesterday's thread, and you can see all of the news stories I used yesterday. Then at the end, after the video is posted, I do post a link to the video in case someone wants to find it that way. All right, moving on. The UK did see a small increase this week to 3,625 new cases. That was up by 8. And deaths did not update, but the most recent death update showed 211 deaths up to July 19th. Maybe that is a new number. I honestly don't know. But either way, that was up by 6.6%. Taking a look at the national allergy map, drumroll please. Yeah, there's a lot of orange in various different places. And you can see here, there's orange in New York State, there's orange in Connecticut, southern Vermont, portions of New Hampshire, a lot of orange in the Midwest and the Plains. So pollen levels, they are out there. Something else that is bad, air quality. And it's definitely affecting me. You heard, I just cleared my throat. This is the way it's been this morning. It was an absolute disaster. But you can see here, like where I'm at down here, we have the yellows, we have the oranges. New York City and New England's even worse. Oranges, even some reds showing up in New York City. That's not good, and it's also extremely hot. Here in Philadelphia right now, or at least in Northeast Philly, I have 98 degrees outside. Yeah, totally ridiculous. Look at the Southeast. Southeast is a little bit of yellow, but then you see the West Coast. Take a look at that. A lot of red, a lot of maroons. Yes, big time problems out there. All right, speaking of weather and climate, you do want to pay attention to my climate data report Twitter account all this weekend. We're going to be talking about a potential tropical cyclone in the southeast, which could become a tropical storm, maybe even a hurricane, and it does threaten Florida. Florida won't likely see a hurricane, but we have to keep an eye on this for the southeast coast. This could be a big deal, so I'm going to be tweeting on that all this weekend with models, data from the Hurricane Center, all that good stuff. Taking a look at today's EMS levels from Philadelphia, it's 852 EMS incidents. Moving on now to EMS calls. There were quite a few respiratory difficulty calls earlier in Montgomery County. Still 14 calls right now. Cardiac emergencies, diabetic emergencies, heat exhaustion, cardiac arrest in Montgomery Township, Montgomery County. That's not good. And we can see here, take a look at this in Chester County. We do see respiratory difficulty a couple times. Heat, cold exposure, you know what that is. Heat-related illness. I mean, they're happening right now. It is a big deal. Walgreens this week had a positivity rate of 39.4%. That was down 0.2%. Testing did go up. Canada, moderate level viral activity for COVID. Flu A, Flu B, and RSV are all low at this time. Taking a look here at wastewater sites. I do need to refresh this. Did this update yet or not? CDC data, okay. Okay, wow. Okay, I'm just seeing this for the first time. I've been waiting for this to update, or else we would have recorded, well, no, we wouldn't have recorded earlier. But you get the idea here. 0 to 19%, which is really low levels of COVID. There's only 64 sites at that level. That's bad. But then we just jump down here to these orange sites, which is 60 to 79% COVID increase detected. 455 sites. And then the red. Red is as high as it goes. 265 sites. So clearly, levels are still rising. You can see here, we had that little pause last week, and boom, the national level's going right back up again. So based on just looking at this, I don't know. Maybe the national level will continue to go higher. I mean, KP 0.3, 0.1, 0.1, which I'm going to be showing you in just a moment, is starting to take over in the United States. As a matter of fact, it did take over. You'll see that on today's update in just a moment. We need to refresh this to see what's happening here. I'm seeing a lot more darker colors here. Pennsylvania just jumped to high levels of COVID activity. New York State's still low, but take a look at the rest of New England. Yeah, it's starting to rise. Take a look at Texas, still very high. California is still very high in Alaska. Still very high in Hawaii as well. Florida, Louisiana, Utah, Washington, Oregon, which Oregon I heard was starting to creep upward once again. Arkansas very high, North Carolina very high. But you can see here the Great Lakes have not reached very high levels just yet. So there is still room for growth in those areas. Let's just briefly take a look at the national wastewater level on Wastewater Scan. Yeah, this is continuing up as well. Even if you X out that wonky movement. Overall, national levels of COVID are continuing to rise in the United States. Alrighty, drum roll please. More new data. Take a look at this. National ER visits for people diagnosed with COVID. These are people coming to the ER with COVID. We'll take a look at the whole country tomorrow, or whichever states are available. We can see here it's not up as fast, but it is still rising at this time, and there were a couple days that really did spike upward. So that is not good to see. Let's refresh this. This is emergency department visits. Let's see here. We want to change this to percentage, and we'll see this nice lovely map. And look at that. Substantial increases in Pennsylvania, North Carolina, Virginia, West Virginia, Louisiana. There's a lot of states with substantial increases. Texas continues to go upward. Kansas, Nebraska, Oregon, it's still rising there as well. We can see it's starting to stabilize now in California, Nevada. Portions of New Mexico is actually declining a little bit. Arizona, Utah, Idaho, Alaska, Hawaii, Florida stabilizing, and New York State stabilizing. That's really good, but again, I think it's really uncertain what's going to happen with New York State. Do they start to drop steadily? Does it just kind of level off? Or what's it going to do? I don't know yet, because remember, they had a LB.1 wave. Now they're switching over to KP 3. I'll show you in just a moment. Take a look here. Epidemic status is growing, and likely growing still in a lot of states. The Mid-Atlantic and Southeast, yes, it's still growing. All right, here we go. Time now for the new CDC variant update. KP 3.1.1 is now dominating in the United States at 27.8%. It has raced to the top. We've seen a lot of these JN.1 offshoots within just a very short time race to the top this summer. KP.3 did it. I believe KP.2 did it at one point, if I remember correctly. And now it's KP 3.3. Or excuse me, KP 3.1.1, which is at 27.8%. KP.3 is at 20.1%. LB.1 is at 16%. KP 2.3 is at 14.2%. And we can actually take a look at the New Jersey, New York, Puerto Rico, and Virgin Islands region. And you'll see here that the old LB.1, there it is, was at 26.8%, and now it just now made the crossover to KP.3.1.1, which is at 28.3%. There's not much differences between the variants. However, KP.3.1.1 is more immune evasive. So again, there's a question mark as to what's going to happen in this region down the line as they're just switching over. Could it extend a wave? Could it just prevent it from slowing? Or could it rise again? Don't know. We'll have to wait a couple weeks. We can't just go off of, well, the last couple days started to look like they're going down. It doesn't work that way. We'll just have to see what happens. Because remember, before, the UK several times, well, they went down for a week or so and then right back up again. Hopefully New York State won't do that. Hopefully they have peaked. Taking a look at New Jersey, we can see 497 people in the hospital, 11 people on a ventilator. In the ICU at this time, 43. And when we take a look at discharges, 78 at this time. And let's see if we can look at cases. I don't know if we can or not. It does look like we are able to take a look at cases. Let's see what they are doing at this time. You can see here clearly this wave is nowhere near as high as last summer or as high as back in the winter time. And we can see currently, well, as of the 27th, they had 2,614 cases for that week's total. And for the week that is ending pretty soon, if I can get it to come up, we can see that the case levels are 1,813. Drum roll, please. We have to see if we have anything from New York. I've been refreshing this all day long. Nope, nothing from New York today. So we will not be getting an update from New York. Of course, we'll try again tomorrow. They don't usually update over the weekend. And we've had a lot of times where on Fridays they say, the heck with it, we're taking Friday off. All right, finally today, taking a look at LA. LA hospitalizations, Los Angeles, California, continues to rise a little bit for hospitalizations. Deaths are actually starting to go. Remember, deaths are the last thing to rise in a wave. Cases, they did rise a little bit, but then they started to show signs that they are peaking, starting to drop. That's a good thing. Positivity rate, though, did remain increasing, 13.15%. Yeah, that's not good. Wastewater went up a little bit. Emergency department visits. These are people diagnosed with COVID. And see, that's at 3.5% in LA, so that is really high. But the good news is, the first sign that they may be peaking is, take a look at this, cases could be dropping at this time. Of course, it would be nice to see positivity rates peak. Hopefully we can see that on next week's update. Alrighty, folks, that does it for the Friday edition of the Pandemic Update. We'll hopefully have another update again tomorrow. We'll have to see how this asthma business goes. And just in case anyone's wondering, just to be safe, yeah, I'm going to test for COVID as well, but I'm pretty sure it's asthma. The air quality's bad. It's extremely hot outside. Of course, I got to shut the air off when I do these updates or else it would be way too noisy back here. So, yep, that does it for today's update. If you enjoyed this, give it a thumbs up. Subscribe down below. Hit that notification bell. Share these videos with anyone you know. And leave your comments down below. I'll see you all again next time. Till I see you again next time, stay safe, everyone, and have a fantastic Friday afternoon. Thanks for watching.